I'm Randy Fulton, and for my psychological disorder, I chose to talk about depression and specifically clinical depression. And I chose this because it's very personal to me, and actually, a few of my friends have it, so I thought I could talk about it on a personal level and on a factual level. The definition of clinical depression is constantly feeling sad or down and you're not really sure why, like you're just upset for no reason and you lose interest in all of the things that you previously loved and you just have no motivation to do anything. And to treat clinical depression, there are a lot of ways, but I think the best therapy technique personally is cognitive behavioral therapy. Because if it's about your past, which I feel like a lot of it would be about your past, so if you're an adult and you're talking about your childhood, or if something happened in your past and you never really healed from it, that could be causing you to be depressed today. And cognitive behavioral therapy focuses on your past and looking into like why it happened, why you feel that way. So I think that would be good if it was about your past. You can go to therapy, talk to your counselor, stuff like that. But if it's not about your past and it's just like about something going on right now or anything like that, you could just do cognitive therapy, which is just talking to your counselor about what's going on in your life or anything like that, and they would teach you to understand why you're feeling that way and kind of focus on like your negative thoughts and how you can turn those into positive thoughts, or why you're having those thoughts, understanding your feelings on a deeper level so you can work on it in the future. So when you start feeling that way again, then you know what to do and you can like rethink why you're feeling this way and work on things like that. And then I do think medication is helpful for clinical depression. It's proven to be effective on a lot of things. My friend actually takes antidepressants to help her depression and it does work for her, but it won't work for everyone depending on what kind of depression you have, how bad it is. But I do think it is effective, and I think maybe you can try other ways first, and if those aren't working, then you can refer to medication and that can help you there. There are a lot of barriers for therapy, and some people, depending on where you live or depending on what kind of place you live in, they don't know about therapy, so they don't know that they can go get help, or if they do know they can go get help, they might not be able to afford it because it can be expensive. And if you can't afford it and you try to get it covered through insurance, not all insurance covers it, so it's very difficult. And there can also be a language barrier because maybe they don't speak English, so if they go to a therapist that speaks English, then they have to get a translator, and that's like a lot of work for everyone involved. So there are a lot of barriers involved in seeking treatment in therapy. And there are also a lot of cultural beliefs about depression, and in Eastern European Orthodox Christianity, they think that your thoughts of suffering that block you from achieving your goals, they think that's a sin. So basically depression is a sin to them. And if I could recommend anything to them, I would suggest that they go get help, but maybe from someone in their religion, so that they can like help them figure out why they're having these thoughts and like explain to them that's not necessarily a sin, but you can like get better from it and you can recover. And in Buddhism, they recognize depression, they accept it, and they suggest meditation as a treatment, which I can totally agree with. I think that can be beneficial if you're depressed, but I think that they can also maybe go to a therapist or try medication or anything else. But I do think they should try to stick to their beliefs and try meditation first. So